Good afternoon. Last night, we received information and confirmation from the Arizona State Lab that one of the people we tested for COVID-19 had come back as presumptive positive. This person is a resident of Pinal County and is a healthcare worker in her 40s. She currently is hospitalized in a Maricopa County hospital and is in stable condition. Public health investigators worked through the night to identify and interview close contacts with this case. Each were provided on recommendations on monitoring for symptoms and how to prevent spread. This person has not traveled anywhere that COVID-19 is spreading widely, and we have not identified an exposure to COVID-19. For this reason, we are treating this as the first sign of community spread. I understand that this sounds concerning, but it's important that people know that public health is prepared for community spread of flu-like illness every year. There are three things I would like every person listening to this or watching this to know to do to slow the spread. Number one, and I know you've heard this often, please wash your hands frequently and for 20 seconds using soap. Number two, don't touch your eyes, nose, or mouth, which are the way that the germs enter your body. The combination of washing your hands frequently and not touching your face can decrease the spread significantly. Number three, if you're sick, please stay home. These are three things that will be the most effective way to prevent the spread of this virus. The final thing that will certainly help is to please make sure when you're on social media and talking with family and friends, you're sharing accurate information. There's a lot of rumors out there right now. Excellent sources for accurate information are the county and state public health websites and the CDC website. I'd now like to turn this over to Dr. Rebecca Sunenshine from Maricopa County Public Health. Thank
you. Good afternoon. I want to talk to you a little today about how community spread is going to change the public health response to COVID-19. But first, let me provide a little bit of perspective. Besides being an infectious disease doctor at Maricopa County Public Health, I'm also a mom, and lots of parents are coming to me to ask me about COVID-19. What I tell them is that just like the flu season, we're all responsible for staying home when we're sick and making sure that our kids do the same. I tell them that I review the new science every day for COVID-19 and that all signs are pointing to this disease acting a lot like flu in our community. The only difference is it's a little more contagious than the flu, and we don't have a treatment or a vaccine. The good news, though, is that kids tend to have milder illness and do not seem to be at high risk of severe disease. Now, a little bit more about our response. Before, when we just had one or two cases, our job in public health was to contain the disease and try to keep COVID-19 out of our community. Now that there is community spread, we all need to do our part to slow the spread, which means keeping sick people away from others. Just like the flu, the vast majority of people will have mild symptoms and completely recover without any treatment at home. Our older adults are at higher risk of severe complications, so they need to make sure that they stay away from anyone who's sick. Now I want to talk a little bit about our healthcare workers. Our healthcare workers are the front lines and they see sick people all the time. That is why they wear personal protective equipment when they treat people with respiratory illness. We ask our healthcare workers to continue to do what they do best, and that's treat their patients, and also to provide them accurate information. Per CDC recommendations, we are no longer going to keep healthcare workers home after they are exposed to COVID-19. We're asking them to monitor themselves daily for fever and symptoms of the illness and stay home if those symptoms develop. As long as they are not showing symptoms, we need them in our healthcare facilities. And now I'm going to go ahead and take a moment for questions.
What hospital did she work at? What hospital did she work at? Did she catch it? Did she contract out the hospital?
So the question is, what hospital did she work at? We are, in public health, we are obligated to maintain absolute confidentiality of the case. And because of that, we're unable to share anything identifying about the case and also anything that could be used to identify the case. And that is why we don't share that information publicly, regardless of what other organizations choose to release. The only time we will release information that can be used to identify a case is if it's important in order to protect the public's health. And so unfortunately, I can't release that information.
What
Does she have
day
any
was
children?
she tested, and how many people was she potentially in contact with? And of those people, how many have you contacted?
So we can't tell you specifically what day she was tested because that can help you identify the individual. What I can tell you is that we have been interviewing the case and close contacts, and we have identified all close contacts and have let them know that they have been exposed and what they can do to prevent the spread and to monitor for symptoms. And that has been done in the last 12 hours, which basically took an entire healthcare,
How many people are we
public health
talking about?
workforce.
How many people are we talking about?
The investigation is constantly evolving, and
Right now, how many people?
any number that I give you right now will be wrong in just a few minutes, and so we won't be able to release that information.
Explain that to folks.
Thousands,
She
is
can
it
tell us
tens
how
of people?
many. She's a healthcare worker. People are going to assume she was in contact with a lot of people. Why can't you tell us which hospital or healthcare facility she worked at and what she did?
I completely understand the concern. What we are doing is we have an ongoing investigation, and we continue to work to prevent spread in the public. And our work to do that is ongoing and continuous, and we will certainly release information that's pertinent for the public to know and that will help protect the public.
Did she
Location
work
is
in
in
Pinal
Pinal
County?
County?
Did she work
Location
in
is
Pinal
Pinal
County or work in Maricopa County?
So,
Go ahead.
this patient worked in Maricopa County, and that's why we're taking these measures. So both Maricopa County and Pinal County are working closely together and 24 hours a day to protect the public and to move forward with the investigation that we need to do.
She lived in Pinal but worked in Maricopa.
That's
Is she a
correct.
mother? Does she have children, family? Are they required now to isolate, stay out of school if she has children? What sort of steps directly related to her immediate family?
So again, that falls under the specifics we are unable to share because of what Rebecca explained. What we can share with you is that we are in constant contact with close contacts, and we are monitoring the situation consistently, and that we are giving instructions, and we are working to keep our public safe. And I just want to reiterate and emphasize that yes, it is concerning, and I can understand it's concerning, but remember, our flu is equally infectious and concerning, and we see many more deaths with the flu, just to keep the perspective about it.
Yes, ma'am, I get that, and when there are cases of severe flu that come by your desk and you know, and there are children that are on the periphery, you inform schools or school districts about what's going on. Have you had to do that in this case?
What I can tell you that we do with severe flu is when we identify that there is a specific outbreak in a school, we will work directly with that school for an outbreak. And I can tell you that we are working with all the close contacts to determine if they are showing any symptoms, and if they do show symptoms, we will test as appropriate, and we will make sure that anyone who is exposed by those individuals is aware so that they can watch for symptoms themselves.
Are some of them school children? Those close contacts?
So again, we're not going to give any specifics about the close contacts, but what we can tell you is that this case stayed home while she was sick, and that is why we really want to emphasize the importance of everyone, the public and healthcare workers, staying home when they're sick. This individual did not expose very many people at all because she was vigilant about staying home when she was sick.
Will you
Can
give
you
us a
make-
timeline on how this happened? When did it start happening? When did she stay home? All this, the timeline.
So I want to just add to what Dr. Sunenshine just said, and that is you guys are in such a powerful position to spread the word that will actually help decrease the spread of this infection. So we are asking you to help us spread the word. And seriously, if people, when they're sick, stay home, if employers approve people staying home when they're sick, if people wash their hands consistently, frequently for 20 seconds with soap and avoid touching their face, we can significantly impact the spread of this infection and this virus. And I feel like working together, we have that potential.
Can
When
we
did
go
she
back and
self-report?
clarify where she lived and where she actually worked, as far as county stuff is concerned?
So the individual lives in Pinal County and works in Maricopa County.
And how sick is she? Is she really seriously ill? I mean, this is the first.
She's stable.
She's stable.
Mhm.
Are you making any recommendations to the governor's office about declaring a state of emergency like other states have?
We are in constant communication with the governor's office.
What will it take for you to recommend a state of emergency?
Okay.
So we are frequently in contact with all of our healthcare partners, and what we're finding out now is that our resource limitations that are in the community tend to be in the healthcare system. So we're in constant contact with our healthcare systems, making sure that they have enough personal protective equipment and that they have enough staff. And then we're communicating that with the state public health department, who is in communication with the governor.
Did she have an underlying illness? Was she asthmatic? I mean, you said she was in her 40s.
So this illness affects people who are, most people who have this illness are mildly ill and will get better without any treatment. However, there are some people who will have more severe disease, particularly in the second week of illness. And this individual is one of those people who did end up having more severe disease, but she is stable and recovering at the hospital.
Can you
And
explain, I'm sorry, go ahead.
Sorry, I wanted to add to that what Dr. Sunenshine just said, which is that is why we ask people to stay home the entire time they're sick.
Can you go explain, Dr. Sunshine, can you explain?
How many people have been tested so far here in Arizona? How many are confirmed? We know one in Tempe, and then how many are
So we can't answer for the state of Arizona, but what we can say is we have tested a number of people in Maricopa County, and currently we have testing in progress, and that number changes. Actually, it's probably changed in the last hour. So what we're more focused on is once a case is presumptively positive at the state public health laboratory, that is when we initiate a full investigation, find all those close contacts, and make sure they know to watch for symptoms so they don't spread the illness.
Dr. Sunshine, I'm sorry, can you explain what you just said about resource limitations and how that affects a possible state of emergency? Are you saying there may not be enough healthcare providers out there? I don't know what to take away from that.
So the reason why we are moving into a response that we do with typical seasonal influenza is because before this disease was spreading in our community, the CDC recommendations were for anyone who is exposed to the illness to be pulled out of work for 14 days. And now we're moving into what we would normally do during seasonal flu. If someone is exposed, we're allowing them to continue working, but monitoring them closely. And if they develop any symptoms, just like during flu season, then they stop working. And that is how we're making sure we're not in a situation where we don't have enough healthcare workers.
When you say this is community spread, you mean you don't necessarily know where the person got infected from. What does that mean for the larger public? We have a lot of big events this weekend, especially with NASCAR and a lot of other large gatherings. What does that mean for those people and for the rest?
Right, so you want to know about what it means in terms of the public.
Community spread, you don't
and
know
community spread,
necessarily
yeah.
where she got it from directly. And
That's
we have
correct.
A lot of large events.
So the definition, so what we look for in an investigation when we have a positive test is we look to see, did this person have travel to an area where there is widespread coronavirus? Number two, did this person have contact with a person who had that travel? We have not been able to identify either of those in this situation. That's not to say that it may not have happened. It's just to say we've been investigating this for 12 hours, which is a pretty short period of time, and that we are going to continue our investigation. At this point in time, we're treating this as community spread, and the definition of that is that we don't have the answers to those two.
Or is
But
there
for
a
the
timeline?
larger
Did she
public,
present, was
those
she at
large
work?
events, what do you recommend for people? I mean, you're not calling for cancellations of this large gatherings at this point?
At this point in time, we're not, and the reason for that is we're going to continue spreading so that we can get a more accurate view of if there is community spread and how widespread it is.
Question about the virus itself, and a patient presents. How far before they present, physically present, are they able to spread the germ before anyone knows? I mean, because that's probably what happened in this case, right? She met with somebody who didn't present with any sort of illness, the germ was spread, she got it, and then she ended up becoming symptomatic. So do you have any sense of how long, I guess, I don't know, you call it an incubation period, like before someone gets physically sick that they can be,
Yep, that's right.
distribute the germ?
So you're asking about the incubation period and when a person is infectious to other people, correct?
Yes.
So the situation is that all the evidence points to a person is infectious to other people when they have symptoms. And that before symptoms develop, a person is not sharing or spreading that infection.
Thank you.
You talked about the process of going through contacts. That seems to me to be it sounds like it would be a very time-consuming process. We can always find more people, without establishing a time frame. Just give us some idea about how on average it would take to go through all her close contacts, and when does it stop?
So you're asking about how long it takes us to identify all those close contacts of a case. And the answer is the very first thing we do when we get a presumptive positive is we go and we interview that case very, very closely. That typically takes 1 to 2 hours. After we have that information, we have a lot of other individuals to follow up with, and we have the same intense conversation with them. We verify the information about how long they were exposed to the case, what kind of a setting they were exposed to the case, and based on the information about that exposure, we make recommendations to prevent the spread. So typically it takes a lot longer than 12 hours to get those long interviews done for each close contact. But I will say that we're in a position now where we have interviewed all the close contacts, and we are working mostly with those healthcare facilities to make sure that they are doing what they need to do.
Without going into too much specifics as to who she is, so was she at work and then walked over to an emergency room and felt sick? Did she get it from somebody who, obviously you said they have to present symptoms? How do you explain that to us? You don't have to tell us who she was or anything, but how did she get it?
Yeah. So what I'm going to say to that is that really speaks to the importance of everybody. Whenever anyone starts to have symptoms of anything, to go home. That's the message that we have for everybody.
So I thought you just said you know how many close contacts she had. Is that correct?
We have contacted all of the close contacts.
Can you tell us how many?
The reason that we don't share that number is because it could change as we find out more information throughout the investigation. We're confident that we've reached those close contacts, but that number does change over the investigation.
So
Like
far,
10
how
or like
many
20?
people? So far, from what you found, how many would that be?
What I can confirm is that we have contacted all of them. So if you have not been contacted by public health, then you have not been confirmed to be a close contact.
I appreciate
You understand it doesn't exactly inspire confidence when you say, we won't tell you where this person was, we won't tell you where they worked. People who may live around this person want to know.
Yeah. I completely appreciate your question, and I completely understand that it may sound frustrating to hear what we're saying over and over, but what I want to emphasize is that we are contacting close contacts. We are in communication with them, and we are monitoring them. I think the message that it is so helpful for media to share is the 3 messages that we were really talking about here, and that's going to have way more, that's where the impact will happen and where decreasing the spread will happen. The specifics, we're taking care of the specifics.
Wouldn't it be more helpful, though, for people to be able to come forward to you and say, I was also at this on this day?
And if that's pertinent, we definitely do that.
And I will tell you that we received 500 calls in an hour last night. So it's great that people want to tell us where they were to see if it overlaps with the individual, but when we put all of our resources toward answering 500 calls an hour, then we're unable to do the real work of working with those who are close contacts and working with those healthcare facilities to make sure that they do stay safe. So we ask you to think of this like the flu season. Are there certain areas of town that you don't go to because there's more flu there? No. This is a situation where I want you to think of it like there's probably some COVID-19 all over, and the best thing you can do is wash your hands, don't touch your mouth, your nose, or your face, and stay home when you're sick.
Have any of her close contacts presented any symptoms yet?
That's, so you're wondering if the close contacts have presented with symptoms? So we're monitoring for that.
So is that a no for right now? Is that a no as of right this moment?
That's what we're continuing to monitor.
But it's no for right now.
I can tell you that at this time, we are still in the process of investigating whether they have symptoms that are related to the contact with this individual.
Are you encouraging these patients to remain confidential if they have a presumed positive case?
So, as I mentioned before, we are unable to control what other individuals or organizations share about themselves or other information. We are legally obligated to maintain confidentiality of these cases in statute. And unfortunately, sometimes when you share little bits of information, like where that individual works, people can piece together what's out there in the media to figure out who the person is. And that is why we don't release the specifics, and we want to make sure that you take home the greater messages of how you can protect yourself and your family.
But you mentioned you got 500 calls. Was that in response to the story about the second patient who worked at a nightclub and went to Scottsdale Osborne?
I can tell you that we received a lot of calls last night related to all of our COVID-19 response, and that in general, we know that the public is concerned, and that's why we really want to make sure everyone understands that this should be treated like a bad flu season, and you all know how to prevent the flu, and you know how to prevent COVID-19.
Well, is that the issue or releasing information?
What can you tell us about